So it was just 2 days to go until I'm heading into hospital for the septorhinoplasty. Getting a graft as well, temporalis fascia graft, just to help the rebuild as things get rebuilt. So yeah, there's still a lot of thoughts going through my head, a lot of things I'm thinking about. And again, it's really interesting because obviously in my work with anxiety and phobia management with my patients, and the reason why I'm sharing this kind of journey so openly is I think just the journey and the understanding of part of the processes that my patients are going through. You know, it's very easy when something becomes very routine to yourself. You know, dental treatment becomes very routine to the provider, but it's a huge life event for the person that's undergoing it, and it's exactly the same with myself. So for me, you know, having this septorhinoplasty is obviously a massive thing in my life, but to the guys that are going to be doing it, you know, I won't even, obviously not going to be the only person that day that they're working on. So it's very, very routine for them. So, you know, bearing that in mind, you know, as I work with my patients is something that is refreshed in my mind as well, not to underestimate the emotional journey that people will go through in the preparation for their own treatment. So yes, it's been a fascinating few weeks, and as I say, I've managed to put that in my mind a lot of the time. There's times when it is coming into my mind. Actually being open about it has been interesting, because for a while I felt as if I didn't really want to talk about it or tell people, because almost it made it more real, or it kind of forced me into those discussions. I think more so with the surgery I'm getting compared to dental surgery, it's going to be rather obvious that I've done it, because suddenly my nose is going to look different. So it's not as if people wouldn't have noticed. But I've actually found talking about it has been quite therapeutic, and just been open about what it is I'm having done, how I feel about it as well. The one difference probably with the dental patients I help is that sense of feeling ashamed or embarrassed about how their teeth are, because there is that sense of it, them perhaps having had some sort of control over allowing it to get to that point, and that's a barrier that people often will feel, that embarrassment about things. So obviously I don't have a sense of embarrassment about my nose, other than I've never liked my nose, and I remember as a kid, you know, especially as a teenager, I would feel quite upset about how my nose was. You know, as a mid-teenager till my late teens, I was convinced I didn't have a girlfriend because of how my nose looked. And you know, the surgery was booked in, so I think it was the year I was about 17, it was booked in for the October, and actually it was cancelled. Now at the time when that was booked in, it was mainly cosmetic I was doing it for. So that was booked in, and then this took a holiday, so I had to get rescheduled, and it got rescheduled for in the middle of my hires. So again, the second date then had to be changed. And the thing that changed my life at that point then was I actually got a girlfriend who asked me a great question and said, you know, are you getting this procedure done because you want your nose to look different, or are you doing it because you care about what other people think? And it made me realise that the answer was the latter. I was doing it because I cared what other people think. And you know, she said, well, you've got a great radar then. If, you know, would you go out with somebody that wouldn't want to go out with you because of how your nose looks? And I said, well, no, and she was quite right. I had a great radar for deflecting anybody who was so shallow that they would reject me for how my nose looked. So, you know, obviously I've lived with my nose the way it looks for, you know, I probably started looking like this, I think, by the time I was about 11 or 12, thereabouts. So it's been a good 35 years that I've been used to this. And that is really weird as well. It's really weird. As much as I don't particularly like my nose and how it looks, it doesn't upset me or worry me or bother me overly anymore now that I'm a middle-aged man, you know. But it is weird thinking that my face is going to look different. You know, my appearance is going to change quite drastically and quite quickly. So that's kind of odd. It's odd getting your head around that, even though it's going to be a positive. And even though I don't like the way my nose looks, it's kind of me, and I've grown very accustomed to it. So it's kind of odd thinking this is the last couple of days my nose is going to look like this after 35 odd years. That is a bit bizarre. But you know, I was saying to somebody the other day, I can actually remember in my teens sitting watching movies thinking if I sit and press my nose hard enough for long enough, you know, a bit like braces, it might start to straighten out a little bit, and then been disappointed that after 2 hours of pushing it, it looked exactly the same as it did before. So obviously this time, I'd actually booked in originally. The appointment was booked in October. I was going to take the 2 weeks October break and get it done then. And it was cancelled again. The doctor took a holiday to an October holiday. For the third time in my life it was postponed. So we're 2 days away and it's still all booked in and set to go ahead. Hopefully it remains that way. So originally it was booked in, it was going to be cosmetic reasons. You know, I had a minor breathing difficulties back then when I was 17, but nothing major. As I've got older, the breathing difficulties have definitely increased. You know, snoring issues, issues when I'm wearing my PPE at work, you know, double masking with big heavy duty masks. By the end of it, you know, headaches, dry throat because I'm having to mouth breathe, just becoming more and more hard. And really that was a decision, but it's fascinating because you start to doubt yourself and and I'd imagine my patients go through this process as well, where you kind of think, you know, do I really need to do this? How bad is it? You know, maybe I didn't need to do this at all. And I completely understand the patients thinking that, because, you know, in the last week or so, I'm thinking, is my nose really that bad? Is my breathing really that bad that justifies going through this, you know? But I then remind myself, if I just breathe, watch what happens just nose breathing. Okay, this nostril's moving. This one isn't, because there's hardly any air going through it, so there's extra force on that nostril. Do you see that? Now listen to this. I don't have a cold. That's how I breathe. And this one. So I've probably got about 10% through my left nostril, maybe. That's maybe 20 or 30%. And I do nose breathe, you know, I nose breathe when I can. It's just really, really poor. So I'm kind of looking forward to seeing what the difference is, maybe because you get used to something. And again, my patients, I'm sure they get used to how their teeth are, the discomfort, the appearance, how things are. And you know, you just accommodate the way things are. So it's going to be fascinating to see the improvement that I actually get. I know I need to get it done, as much as that little part of my brain kind of goes, is it that bad? Yeah, it is. You know, I can't breathe properly, and I need to be able to breathe properly, because it's only going to get worse as I get older. So I know that's needed. Again, that's quite useful, focusing on that and reminding myself of that, and you know, in the days in the run up to this, that yes, this is something that I really, really should be and have to be doing. So that's some of my thoughts right now. I've got another video that I'll post up maybe a little bit later on today about how to manage thought processes and how to manage anxious thoughts, because I am having anxious thoughts, but I'm going to explain to you how it is that I'm actually processing and dealing with them, so that I'm actually feeling okay, you know, in myself. So, okay, I didn't really mean this for this to be such a long video, so well done to anyone that got to the end of it, but I thought I'd just share where my head's at right now. Alright, I'll post again probably later on today or tomorrow.